Hi everyone, my name is Malena and I'm one of the midwives from my Expert Midwife. Today I'd like to tell you about colostrum harvesting. For those of you who haven't heard, colostrum harvesting is when you express and collect colostrum during your pregnancy, you store it and then you use it once your baby's born. Okay? And colostrum is produced when you're pregnant and is what you produce for the first few days after you give birth. Okay? It comes in very, very tiny little amounts, okay, which is essential for your baby's immature digestive system. And it differs from breast milk in that it's a lot richer and thicker. It's packed full of white blood cells and immune boosting properties, and as well as minerals, vitamins, fats, calories, and elements that help to develop your baby's immune system and that help to keep them hydrated. Okay, you might want to express colostrum to have an adequate supply of it in case your baby struggles to feed for the first few days, or you may already know that your baby will need special care or perhaps extra monitoring after they're born. For example, if you have diabetes during pregnancy or you're on certain medication, that will mean that your baby will need regular blood sugar monitoring and regular feeding, and having that colostrum there would hopefully avoid your baby needing to be given formula. Okay, so you want to start ideally expressing from 37 weeks onwards. Okay, if you know that you're having your baby early or prematurely even, you could start earlier, but we would advise that you okay this with your midwife or your doctor to ensure that this is okay for you and your circumstances. Okay, some women can experience some painless tightenings during this expressing or just following it, and this is normal and nothing to worry about. However, if you experience any other symptoms or any pain in your lower abdomen, we would strongly advise you to stop, okay, and contact your maternity unit. Okay, so what you will need to collect colostrum is ideally a syringe. Okay, well, a pack full of syringes, because hopefully you'll be collecting lots of it. I have checked online just to make sure that this was something accessible, and it's really easy to find syringes online. Okay, ideally what you want are small syringes from 1 to 5 ml capacity maximum. This is a 5 ml syringe and it's already quite large. Okay, you'd be having a really, really good day if you managed to obtain 5 ml of colostrum. Usually it'd only be a few droplets, especially the first few sessions, or maybe a couple of mils. This one is the only one that I could find at home, but you can find some online or maybe in the pharmacy that come with a little cap, and ideally that's what you want. Okay, syringes that come with their own little cap. If you bought syringes and caps separately, you could run the risk that they wouldn't fit, so ideally buy them together. Okay, if you really cannot get hold of syringes, you could use a small cup, okay, that you would sterilize beforehand. This is the smallest one that I could find at home, and it's already a little bit big. If you've got anything smaller, maybe a little one of those little tops from oral medicines, that'd be great. However, again, because colostrum comes in such tiny amounts, and sometimes it can be only droplets, you run the risk of it sticking to the walls and not really being able to retrieve much of it. So a syringe, if you can get hold of them, is ideal. And then what you want to do is find somewhere where you have privacy. Okay, you want to feel comfortable, you want to feel warmth, and this will help your hormones do their job. Okay, some women might find it useful to have a couple of practice runs in the bath. Okay, this can give you a little bit of a feel of what you're doing without the need to collect anything, but you don't have to. This is up to you. Okay, so once you're ready to start expressing, okay, we would strongly advise you to wash your hands thoroughly. Okay, find somewhere comfortable to sit. Take a few deep breaths in and out and drop your shoulders. Okay, some women might want to use a warm flannel over the breast to encourage the letdown reflex, but again, you don't have to. What you do need to do before expressing is to encourage the milk flow, okay? And this is done by massaging or stroking the breast, okay? So what you want to do is massage the breast or stroke it from its base towards the nipple, all around the breast. You can use the back of your fingers, the palm of your hand, or you can make a soft fist and either stroke down or roll across, okay? Always from the base of the breast towards the nipple and all around the breast, okay? This can take a few minutes and you might get a little bit of a tingling sensation. Once you're ready, you can start expressing, and there's two main techniques for this, okay? For both of them, what you want is to have your hand in a C shape, okay? And place it at the base of your areola with your thumb and fingers opposing. And then move your fingers back a little bit, pressing gently until you feel a change in texture in your breast, okay? This usually feels like a bit of a dip. If you don't feel anything, please don't worry, okay? If you do feel it, sorry, keep your fingers there, but if you don't feel it, then measure 2 finger widths from the base of the areola and then put your thumb just over them and the same at the bottom. Okay, and then you're in the right position there. So the first technique is super simple. It's literally a compress and release technique. So all you want to do is compress and release, and keep going. The second technique is called the pushback technique. And I'm going to go sideways so that you can see a bit better. This is going to be my chest wall. And what you want to do is push the breast against the chest wall, okay, to put pressure on your milk ducts. Then compress to move the milk towards your nipple and release, okay. This movement is really quite gentle. This is quite a hard breast and it's quite small, so I'm struggling to show it on camera. But what you want to do is push, so press against the chest wall, compress and release. Push, compress and release. Press, compress and release. Okay, so whichever technique you use, you want to do this repeatedly. You get a little bit of a rhythm, okay? When you start to see the droplets of colostrum appear, you want to have your syringe handy and you want to just draw back whatever droplets you obtain into the syringe, okay? If you struggle with this, you can get your partner to help you, or you can practice before you start. Maybe put a little bit of liquid in the bottom of a cup and just practice drawing liquid back with the syringe one-handed, okay? So once the droplets slow down or stop, you want to keep the C shape and move your hand around the breast a little bit, and then repeat, and then again until you've gone all around the breast, okay? And it's as simple as that. You'll have hopefully filled in your syringe, and this is quite hopeful. This is 4 mils. You'll probably get, if you're really lucky, 1 mil, especially the first few times that you do so. Once you've finished, okay, and the session can take anything between 20 and 30 minutes, very individual. I forgot to say, please feel free to swap hands, switch breasts, or take rests, okay? Do whatever you need to feel comfortable. When you're done, you want to get a label, okay? A label that has your name, your hospital number if you know it, or your date of birth, and this is an old one, and your date of collection. And it's a good idea to write down the amount that you've collected, because as you see, this label is quite chunky and it will go over the measurement on the syringe. And if once your baby is born, they're trying to keep a record of how much your baby's taking, when you give your baby your collected colostrum so happily, and then the midwife says, oh, how much did your baby take? And you think, well, I'm not sure. If it was 2 mils or 5, then at least you'll have it on your label, okay? The labeled syringe, you want to put it either in a tub with a lid or in a freezer bag that's got a little bit of a ziplock, and put it in the freezer, okay? Just keep collecting all the syringes with the colostrum, and when you're ready to have your baby, they're there for you. So if you're having a home birth, they're there for you to defrost as per need. If you're going to hospital, then we will advise you to get a cool bag with an ice pack and get the tub or the bag with the syringes, put it in the cool bag, take it to the hospital, hand it into your midwife when you go in. They will put it into the designated breast milk fridge and make a note of it on your record. And then job's a good one. So I hope I've said everything that I wanted to say. I hope it's clear. If you've got any questions or any doubts, please feel free to contact us.